Hi, Karishma. Karishma is also joining us. Hi, Elizabeth. That's much better now. Greetings and welcome to the preparatory meeting of the Europe-India Digital Health Summit. Hello, Caroline. Caroline Perrine, is so great to have you here. Good to have you here. Great. So, and George also joining us from the US. So this is really becoming a global meeting. Welcoming George. Matthew, we just have the pleasure to be in the Infarmed facilities in Lisbon. Infarmed is the national authority of medicines and health technology. It's a great pleasure for us to have their support on this. Hey, and Caroline Perrine is also joining us. Hey, from Geneva. Hello, Caroline. Good to see you. It's great to have you here on board. So I think that without further ado, we can start the call. Hey, George. Good to have your smiling face with us from the US. Amazing, amazing. So I think without further ado, and this is being recorded, this meeting for anyone not be able to join. Oh, and Eric Sutherland as well joining. Let's welcome Eric. As we initially have a lot more registered participants than we are having in the room, but for the sake of our time, which we respect the most, and now we have to have a hard cut in 90 minutes. And Bonnie has to leave us in 30 minutes. What I propose, and Lance Owen, also from the US, welcoming Lance Owen from the US. So this is becoming really a global meeting, hybrid meeting, live from Infarmed. Hey, Lance, good to see you, and welcome. I think on the sake of time, as I was saying, as Bonnie has to leave us unfortunately in 30 minutes. She's required in the Ministry of Healthcare in Portugal for another visit. We are going to take the chance to listen to Bonnie's presentation. And then on the remainder of the hour, we have time to introduce ourselves and go deeper into the goals of this preparatory meeting to discuss how we could be effective in this World Health Assembly side event that we are planning in Geneva, which with the support of the GD Hub and Caroline. It's great to have her here. So without further ado, as I was saying, I would like to introduce you to Bonnie Clipper. Bonnie is a well-known influencer in LinkedIn, as she has accomplished a difficult mark on LinkedIn. This is considered to be the 22nd top voice in health in LinkedIn. She is a trailblazer in nursing innovation and a leading influencer in healthcare. Bonnie Clipper has been at the forefront of transforming the nursing profession through technology and forward-thinking strategies. Her career journey includes pivotal roles such as the inaugural Vice President of Innovation at American Nurses Association, where she developed strategies to engage millions of nurses in the innovation space. Welcome, Bonnie. It's a pleasure to have you here, and over to you to kickstart our meeting.
Excellent. Thank you very much, Paul. Muito obrigada. I'm going to go ahead and share my screen here so that we can actually tee this up with a conversation about what's going on in terms of the impact of digital health on care. So I'm just going to give us some food for thought here as we really think about what we can do together at the larger meeting and things for us to think about today as we talk about planning. Okay. So let's start a little bit by thinking about what's going on in healthcare globally. We are all experiencing workforce supply challenges, ups and downs. We see dramatic gaps in nurses and physicians, and we produce more, and then we see dramatic gaps. We're also seeing changes in where care is being provided, a very, very rapid adoption of technology, not always smart investments or not always investments that are prioritized well, but we're seeing a rapid adoption of technology. Financial pressures only continue to increase, whether it's hospitals and their shrinking margins or government entities providing healthcare to their citizens. We're seeing that finances are going to continue to get more difficult, not more generous. And then in the startup world, in entrepreneur world, we're actually seeing that there is a tightening of funding that is available to startups. It's not drying up entirely, but it's certainly much more difficult to come by. So I want to start a little bit by giving you something to think about in terms of the greater lens here. And because I'm actually a nurse by training and a hospital administrator for 21 years, my lens tends to be the lens of the workforce. And what I see is very concerning. It looks like we will continue to have an increased need around the world in terms of different professions. So based on the World Health Organization, we are actually looking at a shortfall of around 10 million healthcare professionals. And when you think about that, that's actually coming upon us very, very quickly. India alone is short 600,000 physicians. So when you think about those numbers, there aren't going to be enough humans to do the work. So we really are going to need to think about other means to help support us or act as force multipliers to help us deliver the care. What you see in the right corner is just a little snippet here. And this is actually from the NHS from last winter. And the NHS sent out a bulletin to all of their ambulance crews saying that you're going to be waiting a very long time, even with a very sick patient having a heart attack or having a stroke in the back end of your rig. And the reason for that is that we actually are so short-staffed in our A&E departments that we can't help to offload patients fast enough. We realize that that means that some people are going to get worse, or maybe even some people are going to die, but there's nothing that we can do about it at this time. So when you think about it, this is us finding ways to normalize the fact that we are going to have significant gaps in healthcare professionals. So the reason that this is so important to us is that without enough doctors, physicians, without enough nurses, we are going to be extremely challenged to keep our countries well, to provide access, to provide preventative care, to provide acute care on not only a local basis, but a global basis. This was some data that I thought was very interesting. And of course, nursing is very near and dear to my heart. But when you look at the number of nurses that we have in mass, and over 50% of the workforce is comprised of nurses, there is a very, very large gap for us to make up. Over 7 million nurses are going to be needed by 2030. That's a huge number. So again, part of this is having you think about how we can use technology not only to disrupt what we do, but also to help us deliver care in a very, very different way going forward. I also want to challenge you a little bit on the models of care. We know that they're changing very, very quickly. And this is from a global perspective. We tend to be moving away from sick care more towards healthcare. We're also looking at healthcare when it used to be episodic. It's becoming continuous, finding ways to provide preventative care and helping to care as a holistic person. However, we run the risk of this being completely disrupted because if we don't have enough people to deliver the care and we can't use technology to help us, we actually are going to break the chain and we won't be able to provide continuous care. So these are some of the things that we have to think about as we all come together. We're also at a time where there are a lot of benefits and a lot of opportunities that we didn't have even a couple years ago. Care can be delivered virtually now. Care is much more personalized now. In areas that certainly can afford to provide customized care, we can zero in on cancer treatment modalities that are specific to the person all the way down to the gene. So what we can do now is incredibly different than what we did years ago. And one of the things that I find the most encouraging out of all of this is that artificial intelligence is going to provide us with tremendous opportunities. We don't even know what all of those look like yet, but it will have the ability to improve access, to reduce disparities, to reduce the cost of care, and to help leverage the technology to act as a force multiplier for those of us that are in the healthcare workforce. One of the things that we're seeing evolve is delivering care in the right places. And acute care used to be our predominant model. It used to be when we would send a patient, a community member that was sick or in need, we would actually admit them to a hospital, to a brick and mortar hospital. Those are the most expensive places to deliver care. So we are seeing a decentralization of that model. And I don't think that's a bad thing. I actually think this is a very good thing. So it's going to be a shifting of where we need our workforce to be distributed. We're moving, certainly in the US, we're moving more into home care and clinic and outpatient care. However, in Europe and in India, you are actually ahead of us in that there is a public health system and a home care system that is in place. Now, they both need to be bolstered and supported. We need to use technology to improve the quality and the outcomes and reduce the cost associated with that. But we already have some structures in place, so we're not starting from zero. There's a couple technologies that I just want you to think about a little bit today as we talk about how can technology support healthcare. It isn't intended to replace healthcare providers, whether it be a physician or a nurse, but rather to support, to supplement, to complement. That's the way we have to think about technology. And of course, technology isn't cheap. So we need to really think about what's the goal and what's the problem that we are trying to solve. There is tremendous opportunity as we think about the utilization of predictive analytics. This really opens up a whole new world to us. Everything from helping us with diagnosis, prognosis, treatments, quality of care, reducing cost, reducing disparities, improving access. This is a whole new world. So we're going to have to find ways to get better at accessing data and using the data to tell us a story that allows us to do something actionable. When we do that, we have to also reduce the cost. All of these things cost a tremendous amount of money, and we're going to have to get much more effective at how we can utilize data to model and predict and give us future outcomes. That's a challenge that we're going to have to figure out. When we think about artificial intelligence or augmented intelligence, we really don't know the impact yet, but it's vast. It's going to be incredible. Everything from how it can help medical professionals, healthcare professionals, physicians, nurses, therapists, to how it's going to help patients. Even patients alone will be able to utilize AI to assist us with analyzing data from wearables. Think about all of the data that sensors can pull in. No human beings exist to sit down and parse all that data, to literally analyze it and look at what that's telling us. That's one of the very strong use cases of AI. We also can use AI to help us from a chatbot, a patient education perspective, triaging and screening patients. Do you really need to have a physician visit? Could you have a nurse practitioner or a midwife visit instead? So helping us reduce the cost of care while improving access is going to be incredibly important. And then certainly think about everything it can do for physicians around radiology interpretation or imaging interpretation, designing treatment plans that are custom to the patient. We all struggle with documentation. So generating clinical notes or clinical documentation, there is a tremendous amount of opportunity. And then in the US right now, Microsoft and Epic have partnered. So we're really seeing some very strong outcomes around some pilots there to begin to reduce the amount of documentation that happens simply by using speech recognition technology coupled with AI. So there is tremendous opportunity here. Hospitals are actually becoming smart. While this is incredibly expensive, we have the ability to utilize LSE or RTLS to track a patient from the moment they're admitted to the time they leave the hospital. We will know exactly where they are. Are they in the operating theater? Are they in A&E? Are they in a patient room lying in their bed? We will also know where every physician and staff member is at all times. More importantly, though, we'll have the ability to track our patients on physiologic monitors. Typically, what happens today, if you're in a critical care area, we would put the leads on you and we would know exactly where you are and what your physiologic rhythms show. However, if we take you down to an imaging for a procedure or to the operating theater, we have to unplug you and put you on a portable monitor. In a smart hospital, we would be able to monitor you no matter where you are in the facility. These systems also can tell us who's coming in and out of the room, who's visiting. Are people washing their hands? Are people giving bedside reports? We would know if a patient is being turned or moving. We would know if a patient is going to fall. We would know all of these kind of things. So while this is amazing, on the back end, it still is going to require humans to help analyze and evaluate this data. And again, that's going to be one of our challenges with technology adoption. This is ambient computer intelligence. And in the United States, we already have several hospitals that are utilizing this. We mount speakers, cameras, sensors in a patient room, and we actually can utilize AI to determine if a patient is getting out of bed. Are they supposed to be getting out of bed, or are they going to fall? And again, we can monitor and track our patients. So this technology continues to have an increase in the use and the application for us. But our current systems aren't ready for that. So we need to think about how we're going to prepare our workforce to leverage them and utilize this technology. Hybridized care. We are seeing this become the fastest growing care model. And the applicability of a hybrid care model is globally. And basically what this means is that we have the ability to have a nurse on the pop-up on the television or a tablet or a mobile cart that can provide support, education, advice to the patient and the nurse in the room. So if you think about it, this is a two-sided care model. We have a direct care nurse or therapist or physician that's in the room, touching the patient, talking to the patient. And on the screen or tablet, we can actually have a physician, a social worker, a nurse, someone to support that work. So the two sides of this represent a hybridized care model. This has now become the fastest growing care model in the United States, particularly in acute care inpatient settings. And this might be a way for us to actually increase the scope of what a nurse cares for in person while providing them with extra support and supplementing them, offloading their documentation, doing patient education, observing a critical patient, talking to family members, orienting new nurses or new physicians. So it has tremendous applicability to us. And again, on an international level, I think there's a lot of room for this to expand and grow. RPM, or remote patient monitoring. This is something clearly that's growing very, very quickly as well. The ability to monitor a patient, their blood glucose, their temperature, their blood pressure, their weight. We can monitor a variety of different biometrics from a patient's home and send it into their care provider, whether that be a physician or a nurse practitioner. And then what do we do with that data? Will that help us to provide care for someone in a rural community so they don't need to come in and visit the provider? Can we then give them that care in their home? Will they have the ability to receive a prescription or a treatment or a medication so that that patient doesn't have to drive an hour or 2 or 3 to come in and see a provider, but rather can stay in their home while they're receiving care? So again, tremendous opportunities for us to think about how do we create the care models that incorporate this technology. And we think about, while this sounds like George Jetson, we actually think about how do we use robots? So these are all robots that are utilized now in different healthcare settings. The one on the far left is actually Moxie. Moxie is a hunter-gatherer. So hospitals deploy Moxie, and what Moxie will do is go to the pharmacy for you, go to the cafeteria for you to get food for your patient, pick up medications in the pharmacy, pick up supplies for your patient, and bring them back to you so that a human being doesn't have to do that work. And what we're seeing is that hospitals that are utilizing Moxie in the pharmacy, they're able to free up those 3 or 4 pharmacy staff, and now they're being trained to be surgical technicians in the operating room or nurses. So it gives us the ability to offload the non-value added tasks and instead upskill those workers so they can do something much more important. Then in the other 2 pictures, you really see our robots that are utilized for behavioral health or even to avoid loneliness, if you will. The bottom one is being utilized for senior citizens, and it talks to them a couple of times a day to ask them how they're doing, and their answers are all recorded and analyzed. It reminds them to take their blood pressure or their heart rate or their glucose or their pills, and then it documents that. So we're seeing more and more deployment of these kind of robots, and Japan is actually one of the leaders in this space right now. And then if we look at the child and the robot, this is another mental health robot. And what this robot does is it focuses on kids that have autism or special needs or learning disabilities, and it can speak to them, and it does a little bit of therapy with them as well. So this is yet one more way to help us really increase technology to be a force multiplier, to accomplish things that we don't have enough human beings to do anymore. These are some emerging tools that are being utilized by clinicians. So on the left, this is really not that fancy and not that new. This is just a Bluetooth earpiece. What we are seeing is more hospitals are deploying that earpiece to allow therapists, physicians, and nurses literally to dictate their notes through a speech recognition technology, and it will then document those in their electronic health record. While it doesn't seem very high tech, it is a time savings. And we know right now that about 36% of the time clinicians are documenting. That's the top cause of burnout. So we really have to figure out ways to eliminate literally typing at a keyboard and documenting. But instead of offloading these tasks, we have to simplify the workload. Then what you see in the middle here, these are really neat. This is actually a wound care tool, and these are glasses that are thermal imaging glasses. So if you were going into a patient's home or an outpatient setting, you actually could assess how large, how deep, how many cavities a wound has. It will transmit that data perhaps to a wound care physician or someone that could help you develop a treatment plan and then care for this patient. So again, this could help you keep patients out of the hospital, but rather care for them in their homes. And we know patients much prefer being cared for in their homes over coming into the hospital. And then on the far right, you actually see a stethoscope. This is gaining a lot of adoption in the United States right now in medical schools and nursing schools. This is the Echo. So the Echo is literally a smart stethoscope. It's Bluetooth, Wi-Fi, noise canceling. So it literally allows you to focus in on the anomalies or the sounds that are different, that are wrong. And it allows you not only to isolate those sounds and hear them more clearly, but you can visualize the waveform, which makes it easier to understand what is going on with the patient. And you can save an MP4 file of that and upload it into the patient record, or you can save an MP4 file and send it to a consultant that's maybe in a different state or different country to actually listen to what you're hearing and what's going on to validate that. So these are all ways that we can continue to extend what humans do on the ground with the patient and send it back to others that might have a larger scope of patients that they're caring for. Finally, I think it's important for us to also consider when we talk about workforce challenges, there are not enough faculty to help us grow new nurses or new physicians or new therapists. So that too is a challenge for us. We have to find ways to leverage that. And one of the things that is gaining adoption, although it's very slow, that's virtual reality. And of course, what virtual reality does, or the metaverse, what those allow us to do are to create virtual assets that help us through critical thinking and problem solving. And when you couple that with the handpieces, with the haptics, it provides feedback about right or wrong decisions. And this is a great way to teach upcoming professionals, because what it does is it actually helps the education to last 7 times longer than it would in the traditional education or academic way. And why this is important is because we also have a faculty shortage. So growing more healthcare professionals is incredibly essential to us, as well as finding ways to leverage them even more by offloading the things that humans don't have to do anymore. Wearables and sensors, this continues to grow. And while I think there's a tremendous opportunity here, I also think this is one of the things that could drag us down a bunny hole if we're not careful. So what you see here on the top right and left, this is actually a way to not only monitor your glucose, but also it autonomously provides the insulin through a tubeless insulin delivery system. And if you look at the bottom 2 corners, what you see on the left is actually it's called a puck. It's a vital sign gathering tool. So it actually gathers temperature, heart rate, and they are working right now to get FDA approval on blood pressure. But imagine what that means in hospitals if no one has to take a blood pressure anymore or vital signs. That frees up a tremendous amount of time. Now, the downside of that is it's continuous data. So once again, this is where we could utilize artificial intelligence to help us figure out how do we get a snapshot of the vitals of these patients instead of just getting billions and billions and billions of data bytes that we're never going to use. On the lower right, this is fascinating. We're using this in a lot of hospitals in the United States right now, and this is for patients that have a difficult challenge turning and repositioning themselves, and we're utilizing it to prevent the very expensive problem of hospital-acquired pressure injuries. Those are incredibly expensive and very painful and very challenging for us to resolve once a patient develops that. So by knowing in advance who needs to move and how much they need to move is incredibly helpful to us. There are also a tremendous number of growing platforms and apps that are patient-specific, whether it's the one on the left that's digital twins. It's creating an avatar to have a conversation with a patient. These are used right now for screening and also patient education. And you'll see the other apps here on the screen allow patients to pay their bills, to schedule appointments with their physicians, maybe even schedule a pre-admission lab process or an imaging X-ray with a hospital or with a provider just on their phone. And part of the reason we're doing this is, of course, patients continue to grow in their world of being a consumer and are very used to utilizing a device such as their phone or tablet to make those appointments right now. So giving them the ability to do that in a safety, high secure, encrypted, and private way is something that's going to benefit all of us. The other thing that's important to think about is while that there is a shortage of healthcare professionals, there's also a shortage of office staff to support those professionals. So if we can offload some of these very mundane activities, while they're very important to do them well, let's take a look at what technology we have to assist us in offloading those functions so we can continue to pull the human beings up to the top of their ability or the top of their capacity. So just to sum this up, I really would love to kind of leave this with you in terms of technology. There are a million shiny objects out there. And I think we always have to have caution about chasing the shiniest, sexiest, brightest technology. And instead, I would offer you a framework. And the framework really needs to be mindful of what are the basic things we need. So think about Maslow. We want to talk about what can we offload that's more low risk. Are there ways to do billing, pre-authorization, scheduling, appointments, things of that nature? That's a good place to start to build a foundation. And then move into speech recognition, recognition technology, virtual care, chronic care management, things of that nature. And then certainly after we get all those pieces in place, maybe down the road in a couple of years, as we continue to develop this whole paradigm, what are the opportunities for therapy, diagnostics, imaging, et cetera? We know that the challenge is that everyone only has so much money to spend. Whether you're a hospital or a health system or a government, there's only so much money. So how do we begin to prioritize what our needs are and make sure we adopt the right technology? So in the spirit of workforce challenges, just giving you something to think about as you continue to move through your conversations today. Start with administrative tasks, simplify documentation, and find ways to streamline workflows. Generally speaking, this is the safest entry point to get into and to continue to grow from there. Thank you, Paul.
Thank you. Thank you so much. It was so interesting to have this opening for our preparatory meeting, and I would like to acknowledge newcomers to the meeting, and also to say goodbye to Bonnie, as she has to leave in a few minutes. So unfortunately, we don't have time for quick questions to Bonnie, as she's pressed for time now for the other engagement.